Arthroscopic subacromial decompression is performed in individuals with external impingement syndrome. Step 1 is to verify pathology in the subacromial space with fraying of the CA ligament and matching changes on the bursal aspect of the rotator cuff. Once a diagnosis has been confirmed, debridement of the acromion is carried out with any commercially available ablation device. Once the acromion has been thoroughly debrided, it is important to assess the size and shape of the acromion. With the arthroscope through the lateral portal, a blunt trocar can be passed from the posterior portal and the acromion literally palpated and the shape and size assessed. In this case, a type 3 acromion is evident utilizing the blunt trocar, and this type 3 acromion will be shaped to a type 1 morphology. An acromionizer is then placed through the posterior portal and is used in a cutting block technique to remove the anterior bony spurring. It is important that the posterior portal not be placed too inferior, otherwise the hand must be dropped and gouging will occur. It is also important to make sure that the barrel of the acromion is flush to the posterior aspect of the acromion such that bone can be resected without gouging. The acromionizer is used in a posterior to anterior fashion as well as sweeping medial to lateral. Once a satisfactory decompression has been achieved, the arthroscope is placed in the posterior portal and the acromionizer in the lateral portal. The anterolateral aspect of the acromion is not well visualized with the cutting block technique and must be treated in order to complete the full bony resection. Once the anterolateral corner has been satisfactorily debrided, the arthroscope is again introduced through the lateral portal and a blunt trocar is again introduced through the posterior portal, and the shape of the acromion again assessed and a type 1 morphology should be present. If the acromion is thin and curved, the cutting block technique must be modified such that fracturing or gouging of the acromion is avoided. Once the acromion has been resected, the rotator cuff is then repaired arthroscopically.
Okay.
Now we jump to finish.
Yeah, we'll just let it play out for
Okay.
a second. Just so it. This is very annoying.
It's kind of weird.
It really is weird.